right, it is hard to believe here as we switch gears, but after 3 long years, the COVID-19 public health emergency is ending. The declaration was first put into place in February of 2020. After social changes, countless hospitalizations, 1.1 million deaths in the United States, it expires finally today.
Yeah, we've come a long way, haven't we? So CBS News Miami's Teri Hornstein is live in Miami. And Teri, I understand that you did some digging into what this means going forward. What have you found?
Hey, good morning, Keith and Betty. Well, it doesn't mean people still aren't getting sick from COVID-19. Doctors are still seeing hospitalizations, and they're still keeping a very close eye on several different variants of the virus. But it does mean that our healthcare system is able to manage the virus at this time. It also means there are several things we should all know about going forward as this public health emergency expires. So let's take a look at some of those things that will change as of today. Now, first of all, vaccines will still be available for free, but for now. But they will eventually transition to the healthcare market once the government runs out of the stockpile they bought. Medicaid will cover vaccinations without a copay and testing until the end of September of next year. They're giving us some time for that. COVID-19 tracking will also be scaled back. New infections will no longer be reported, only hospitalizations and deaths, as well as the CDC continuing to track all the different variants of COVID-19. We did speak to infectious disease specialist Dr. Eileen Marty, who says immunity levels are high enough where doctors are able to manage putting an end to the emergency. But she says everyone still needs to protect themselves.
We all have to be conscious of the lessons we learned so that we don't fall into this trap. It doesn't mean that there won't be more perhaps even very significant variants of COVID-19, of the SARS-CoV-2 virus. That may happen. We are still seeing substantial numbers of patients coming to hospital and having to be hospitalized for COVID-19. It's just that the percentage is so much lower, and our hospitals now know how to manage those patients, protect those patients, cure almost everyone, and protect other people coming to the hospital from those patients.
I did ask Dr. Marty about those immunity levels and what that means for quarantining going forward. And she said because so many people have immunity, whether it's from being vaccinated or from exposure and getting the virus, she says we don't have to quarantine the same way we used to if we've been exposed to the virus. But she does say anyone who has a respiratory infection should stay home if they can. But if they have to go out, her advice is still to mask up to protect other people as well as yourselves. We're live this morning in Miami. Teri Hornstein, CBS News, Miami.
Yeah, I guess it begs the question here. Okay, so obviously virologists, we've learned so much from this. Virologists, the government, you, me, everybody's actually learned probably more than we've ever wanted to know about COVID. So how does this prepare us for future pandemics or even epidemics?
You know, that's something I did ask Dr. Marty. Are we prepared if there is another pandemic? And she says that's something the Biden administration has kept a very close eye on and they're working towards. She says we have more supplies of medications, we have systems in place and people trained and ready to manage any sort of outbreak. But she says the most important thing here is to be prepared and keep this in mind going forward. But Keith, as you said, we've learned so much since COVID-19 began back in 2020.
Yeah.
Hard to believe it was more than 3 years ago at this point.
Right, and that in of itself is part of the preparation. Okay, thank you, Teri.